Hi, I'm Claire. I'm going to be giving my speech this evening regarding juvenile idiopathic arthritis. I'm going to introduce my audience, my boyfriend Caleb and my mom Jenny. All right, thanks for joining me, you guys. So tonight I'm going to give you a presentation on the impacts and realities of juvenile idiopathic arthritis. Shortly after my son Cameron turned 18 months old, he stopped walking. He was unable to hold onto his sippy cup in his hands, having to hold and cradle it between his wrists because he could no longer hold anything due to joint inflammation. He was covered in a red hive-like rash and experienced fevers excelling up to 104 degrees. After numerous trips to the doctors and hospitals, insisting that my concerns for my son's recurrent symptoms be investigated and addressed, we finally got an answer, and he was diagnosed with juvenile idiopathic arthritis, also known as JIA. Today, I'm going to share with you exactly what JIA is. JIA is an childhood autoimmune disease that easily impacts 1 in 1,000 children yearly, with signs and symptoms that can be easily missed and misdiagnosed. Since my son's diagnosis in 2010, I have been researching the subject matter. I've spoken with several doctors and other healthcare professionals based again on their knowledge of the matter, as well as I keep up to date with treatments, diagnoses, and how to manage flare-ups. I'll begin by giving you examples of different types of JIA. Juvenile idiopathic arthritis refers to several different types of arthritis which involve chronic inflammation of the joints and often gives great pain to the individual. Idiopathic meaning unknown origin. It's unknown what the cause of JIA is. Oligoarticular JIA involves 4 or less joints and accounts for 50% of all JIA cases. Children with the oligoarticular JIA are at risk for developing an inflammatory eye condition called iritis or uveitis and are required to see ophthalmologists regularly. Polyarticular JIA typically affects 5 or more large and small joints of the arms, legs, as well as the jaw and neck. Can be diagnosed anywhere between the ages of 6 months to 16 years. Children who are diagnosed with this condition often are not relieved of it ever, and it follows them to throughout adulthood. Systemic onset JIA, the least common type of juvenile idiopathic arthritis, accounts for 10% of all cases. Along with joint pain and swelling, patients are often experiencing high fevers of 103 degrees plus and a salmon-colored rash that will come and go. And finally, the enthesis-related arthritis, also known as spondylar arthritis. This presents arthritic symptoms in attachments of ligaments as well as the spine. Children may complain of back pain and stiffness. Now that you're familiar with the different types of JIA, you may be wondering how exactly are these conditions diagnosed? While there's no blood test that can be used to singularly diagnose the JIA condition, they use a cumulative inquiry of physical findings, medical history, and the exclusion of other diagnoses to produce a positive diagnosis. Physical symptoms present themselves in frustrating patterns, including pain and stiffness in joints, reduced activity and energy levels, and a reluctance to use arms or legs and other ligaments, limping, persistent fevers, and rashes, difficulty with fine motor activities, as well as chronic pain. There are many other conditions that manifest symptoms that are similar to JIA, including infections, childhood cancer, bone disorders, lupus, Lyme disease, and other autoimmune disorders. These must be ruled out before a diagnosis of JIA can be given. Once a positive diagnosis has been confirmed, treatment can begin. The overall goal of treatment is ultimately to control those symptoms, prevent joint damage, and maintain function. Steroids are the first line of defense. Oral steroids are given only under circumstances where fevers are high and are unresponsive to NSAIDs such as naproxen or ibuprofen. They're only used for a short amount of time. Steroid injections are targeted and will be used to induce a rapid relief from inflammatory symptoms. Medications are also used as a second line of defense. Disease-modifying drugs, commonly referred to as DMARDs, include a low-dose methotrexate, which is a chemotherapy drug, and is combined with a biological drug such as Enbrel, Humira, or Remicade. Lastly, physical therapy and occupational therapy are recommended for all patients. These therapies aim to preserve and restore joint function and alignment and help achieve a healthy pattern of mobility that is fluid and normal. It is definitely important to keep the body moving. In summary, JIA is a childhood condition that impacts the child's joints and inflammation, as well as endowing them with pain. JIA symptoms are so similar to various other disorders and diseases that they need to be ruled out before a diagnosis can be made. And treatments are available and they aim to control the patient's symptoms, to prevent that damage to the joints and help them maintain their function. Sometimes finding a diagnosis for anything is more like a process of elimination than an exact science. And it can be a frustrating and devastating road that you're led down as a parent, trying to find an answer to your child's ailments. I never thought that by keeping a record and journal of my child's symptoms would help the medical professionals arrive at a correct medical diagnosis for my son's condition. I hope that by sharing this information with others, this will encourage other parents to advocate for their children to ensure that their children are getting the proper medical attention that they need and deserve. Thank you for listening to my speech.